I wanted to go to anxiety because I think it's kind of the beginning jump for this. So a couple questions that I had regarding this topic are, what are some tips and tricks for anxiety management?
Yeah, I think that this is great because anytime you're going to go see anybody, the goal is not that you're going to fix it, right? Like you're not going to go to see somebody and it's all of a sudden like take this medication, now it's gone. It's really about how do I deal with this on a consistent basis and how do I bring this into my life? The easiest thing is you have to focus on the basics of good quality life. You have to get good sleep, diet, good exercise consistently. As athletes, you guys have a little bit more control over that. But I think you have to acknowledge what you're feeling, right? So don't blow it off. Acknowledge and validate whatever you're feeling. If it's anxiety or anything else, acknowledge that that's happening. Even though you don't have to say like, I'm going to sit here and focus on only the positive or sort of be way over the top about it. I think you can emphasize what's positive in your life and emphasize what control you have, and then control the controllables. I talk constantly about this idea of circle of influence in your life. And I think if we all did this a little bit better, we'd have greater control. There are a lot of things that are really stressful in this world. In the middle of this pandemic, everything's been magnified. But this idea of a circle of influence is think about what you have control over and what you don't have control over. If you have control over it, then modify it. Apply things to change it. If it's outside your circle of influence, if you don't have control over it, then don't waste your time stressing about it, right? COVID-19, super stressful. Do you have control over it? Only certain parts of it. You don't have control over the spread. You have control over your own exposures. So you can decrease your anxiety over COVID-19 if you say, I'm going to be careful about my mask. I'm going to be careful about my exposures. I'm going to be careful about the things that I take part in. And so staying within your circle of influence, I think, is important. And then if your anxieties or anything revolve around your sport, think of things outside of that. What are the other things that are good in your life? What are the other things that you take joy in? Identify an identity outside of just your sport. If we depend upon any one thing, if we say, but the only thing that I care about is being a basketball player, and there's trouble in being a basketball player, your whole identity is in trouble. You got to identify ways that you have these other identities outside of whatever your sport is, whatever is causing it. We have some additional like specific tricks. I say tricks, but what they are is like sort of ways to apply things that if people are struggling, recognize that if you come in and see myself or one of our sports psychologists or any professional that's in mental health, we do have skills that we can apply sort of across the board that help people out. So beyond just sort of like really taking care of yourself, we do have specific things that we can run through if somebody's struggling.
Now, as you make point of seeking professional help, and when people see this professional help, are there any sorts of clinical anxiety types, actual names for things that these people or categories that these people may be going through or feeling? Are there any specifics towards that? And with these specifics, do you guys have, or do medical professionals have tactics in order to cope with them?
Yeah, it's a great point. So we do, on the medical side of things, we have really specific terminology and diagnostic criteria that we use. So I think it's sort of interesting. Forever, we've never talked about anxiety and depression, almost like those were, secret taboo words that you don't really bring out. And now they're almost overly used. It's like the people who need the diagnoses don't use it enough, but the people who don't need the diagnoses use it all the time, sort of freely. And we use depression as sadness. We use stress for anxiety, and we flip those terms back and forth. What we're really talking about is somebody who has something that bothers them on a consistent basis regularly and with enough to affect their lives, right? So there's a difference between anxiety and then appropriate reactions. So if you have a big important test tomorrow and you're anxious about that test, that's not an anxiety disorder. That's an appropriate response. If a loved one or a family member dies and you're extremely sad about that, such that it takes you away from school and sport and all these things. That's not depression. That's what we call an adjustment reaction. You're having an appropriate emotional response to a bad outcome. Depression and anxiety often don't have those obvious triggers. They can have things that make you feel worse and amplify them, but oftentimes these are persistent senses of difficulty through their lives. So with anxiety, we often talk about generalized anxiety disorder. That's sort of like the catch-all diagnosis for people who suffer with general anxiety. That's this sense of like persistent dread or worry, almost like you can't get comfortable, even if you can't identify exactly what's making you uncomfortable. You might have triggers, you might not. You might have this persistent worry about your health. You might be somebody that like every single time you have a symptom, you Google it and you're just convinced that you're in really bad shape or have a terrible diagnosis. You might worry about others. You might worry about family members. You might worry about things that, and you might even be insightful to it. Sometimes people with anxiety, if they've had it for a long time, recognize the sense of, this makes me so worried. I'm so scared about this scenario. And they recognize that if anybody else said the same thing, they would be like, no, that's sort of silly. I don't know, why would you be so worried about it? But within themselves, they can't help it. The response to that all the time is like, oh, just like, don't worry about it. Just like chill out, just relax. It's not that big of a deal. And again, to bring it back to the asthma comparison, imagine if somebody was having an asthma attack, one of your fellow athletes was having an asthma attack, and you're like, hey man, just breathe better. Like, just don't stop breathing so hard. Like, that doesn't help. It doesn't help somebody who's having anxiety. They know that they should just calm down. They can't. So they need to have some sense of tool for that. And there are exercises that any psychologist or counselor, some physicians who are sort of trained in it can you walk you through some of those things. Anxiety and depression both, by the way, can have very physical symptoms. My heart's racing. I'm having trouble breathing. My stomach hurts. Joint pain. There's all kinds of very physical symptoms that can happen. So that's all generalized anxiety. You can have performance anxiety. So people who are relatively fine, but in high stakes scenarios, competition, tournaments, testing, things like that, that creates new problems. You can have a panic disorder. So people who have like panic attacks. These are people who have intense moments or episodes where they lose control of what their anxiety is. Sometimes it's an obvious trigger, but sometimes it's not. A lot of times panic attacks happen when somebody's at the grocery store or out in public and they don't really know exactly what set it off, but they know that it's happening and they don't have much control over it. And then there's like really specific things, social phobias, people who are worried about being embarrassed in crowds or things like that, or post-traumatic stress. So people, somebody who's had a particularly bad event that has created an inability with them to really handle emotionally triggers that are similar to that.
I think that's an excellent clarification that can be very useful for many. Not a lot of people understand all of these differences, and I think in identifying these and pointing them out is going to help people really understand what exactly they might be feeling and how it kind of correlates to that.